Okay, guys, let's try this again. Paula rebooted, so hopefully that's all we needed. We'll let everybody kind of start streaming in here. Looks like we're connecting. I'm in Colorado in a different area than she is, and we had a big storm here today, so let me grab and let her join. Okay, so I see some love coming in from you guys here. Yay.
That works. Yes.
Oh my
Perfect.
gosh. When in doubt, reboot before you throw it across the room. So
yes.
I will try and get my forehead in here. Before we jump in, Miss Paula, I just want to back up just a sec since we had to reboot and give a little bit of backstory. So last night we were here. It was the night before you released. So I'm so excited to talk about your procedure today. But we lost our recording last night. So we're sucking in the technology.
We got this. Are you recording right now?
I am.
Okay, perfect. I'm not going to touch it because I'm afraid that it's going to mess something up.
So those of you who joined us live last night, you got an incredible hour of chat and learned all about Paula and why we're working together, not just as a client, her being my client, but because she's a wellness practitioner. She's going to talk about that at the end for those who weren't here last night. I am just a piece of the puzzle. I'm not all of it, and she's a piece of the puzzle, and we just help complete your comprehensive health team, if you will. So that was a great conversation. Tonight we have a lot going on, you guys, because she had a release this morning. Yes. She left Texas yesterday morning to come here to Colorado to see my guy. Dr. Bieneman is the only person I refer to in the state of Colorado, so we'll talk about that. And so she had a big day yesterday, a big day today. And I'm excited to do this post-procedure.
Yes, me too.
Visit. So tell us how you're feeling.
I'm feeling good. For those of you who watched my stories, I was feeling a little rough right after. But within like an hour or so, like I felt like my nervous system calmed down. Like I was in a lot of pain right away, but then that kind of subsided and the Advil even wore off like past 3 hours, and it's been fine. It's a little weird to talk. So
you sound good.
Thank you. I was like, I'll let you drive. But overall, I'm feeling good.
Good. How is the pain now? Is it manageable? The Advil's working, but you said it wore off.
It did. So, well, I meant like, you know how he was telling me you're supposed to rotate. So like do Advil and then 3 hours later do Tylenol. And I like definitely passed that mark. I think I went like 4.5 hours. And then I was like, oh, I'm going to be talking. I should probably take something.
Yes. Well, and I know you're not a big fan of medicine, you know, and I'm the same way, but sometimes you have to.
We just got to do it.
Yeah, you got to stay ahead of that a little bit.
Yeah,
so
absolutely.
Okay, so do you want to fill us in? So today was the first time that you actually met Dr. B, and this is common because I've had so many people fly in, they see him. That obviously shows a good amount of trust between me and him and my clients. When I feel like you put a lot on me or a lot of trust in me when you're okay, I'm going to be ready and I'm going to go see this guy. It reminds me of, years and years ago in 2005, I had melanoma and I had melanoma.
Oh my gosh.
And I was being treated, and I lived in Montana, and I was flying to Denver to have surgery and treatment, and I never know if I'd go home alive or ever go home. Like, it was so weird to meet my surgeon and my oncologist the same day.
Yeah.
And you're like, it's so weird. Meet them on Friday and you're having surgery on Monday. It's so weird.
And it's like, hello, nice to meet you. All right, sever my mouth.
Yeah, right. So tell us about your experience with him. What was your initial, how you felt going in there, how you felt having a chat with him. Tell us all the things about Dr. B.
He was great. It's funny, like I went in thinking like, okay, it's going to be like a 5-10 minute procedure. We're just going to go in. He's going to do a quick check. Cause I'd actually had someone look at my mouth in Dallas, and it was like, she looked at my mouth for maybe 3 minutes and then was like, yep, you're tied. Okay. Like make an appointment. That was kind of that. And so I was like, all right, it's going to be like the same thing. And he was so thorough. Like he asked me so many questions, and I just felt like he had such a patient-centered approach. Like he was just very my job is to make you comfortable. Like, my job is to make you comfortable. Like, I'm not here to be like, why are you anxious? I'm here to be like, okay, you need a break. Like, let's give you a break. So I really appreciated that as someone who like has anxious spells on the table.
Of course. Yeah. I think we all do.
Yeah. And so I just really appreciated him. I think he was really thorough. He, and we talked about this, and we can go into it later too, but he brought up a couple other things. He was like, this is going to be a piece of the puzzle for you, but I think there are a couple other things, you know, that we need to look into. One of them was TMJ, which was one of the things that I've known, just like wanted to put it on the back burner to never think about. And then the other was, I'm going to have you say what it is because I already forgot what it is.
So upper airway resistance syndrome.
Thank you.
Yeah.
Thank you. Yes. So he had like a few concerns just based on, you know, my sleeping and fatigue, that was something I should look into, which was also something that you had pointed out. So kind of another thing to look into. But anyways, overall, it went really, really great.
Good. His chairside manner, it just couldn't.
So good.
It just couldn't get better.
No.
If he served me a hot, fresh Toll House, I wouldn't love him any more than I do, because he is just that. I felt that myself when he took me under his wing and taught me so many important things about my practice, but also picking up the phone, calling me after hours, calling me the weekend, you know, to have conversations just about learning and about things. So his chairside manner is fantastic.
It was amazing.
Yeah,
I'm glad I traveled.
Good.
Yeah.
You know, everybody's perception is different. And so I always think, well, okay, will everybody appreciate him like I appreciate him? So that's good. Yeah. So let's touch real quick on what you were talking about. So the TMJ. Yeah. So we all have that joint, you know, and that's always, so more, he's meaning like there's something going on here. So that would technically be TMD, temporomandibular dysfunction. We all have the joint, okay? The temporomandibular joint. And like you and I were talking, that's very, very common in somebody who has a tongue tie. Yeah. The styloglossus muscle starts at the tip of the tongue. It inserts back here. It's very, very involved in a lot of the complaints. And so it is a piece of the puzzle. Also, people who have sleep concerns, tongue ties, you know, we see grinding, we see a lot of that stuff. So there's some things that we'll throw in, definitely. But that is real common. The most important thing as you go through therapy, and now that you're released, you're going to feel a little bit different real estate in your mouth, because people, my clients are always like, there's bumps in the roof of my mouth. Like,
it was so weird when he released it. I was like, I don't know how to swallow. Like, there's this huge thing in my mouth that I've like never felt before. Like, you can reach places, and now it's a little harder than when he released it without the stitches. But I was like, oh my gosh, like,
isn't that
this is so weird. It's so weird.
Some of my clients,
this is how mouths are supposed to look.
Yes. Some of my clients have been like, ew, gross. I'm like, that is called Raphe, and it should be there, you know, that, oh my gosh, or Ruge, not Raphe, but that palate Ruge should be there. Those bumps should be there. You should be able to clean around your teeth. And that's why when I ask questions in an assessment, you know, about somebody's decay rate, that kind of stuff, if you can't use the tongue as a tool, then that's one of the screening things. When you reach your back molars, a lot of my clients have cavities right along the gum line because the tongue can't reach down there. It's meant to clean. It's meant to help you chew your food, and you're supposed to chew bilaterally on both sides, but it's meant to help you keep the food on the chewing surface, and then it's meant to help you gather that food into a bolus so that you can swallow it correctly. So a lot of people are surprised about that. So the joint, as you continue with therapy, again, sometimes you have to do a little bit less. Always reach out to me if you really feel like there's an issue, and we'll dive more into my TMJ protocol. But I ask you to do this, and might feel like doing this. You got to find somewhere in between. So if it takes you 3 days to do 2 days worth of therapy, there's no myofunctional therapy spankings here. So you have to be able to do what's realistic. Okay. So just know, like, reach out to me, but I will make sure now that I know that, know more of that, that we work that into your protocol. But the biggest thing is, if it bothers you, you got to figure out how to not have it bother you, because it's life, you know?
Right.
And then the last thing about sleep. So I pulled your report up, you know, just to make sure that, okay, he had concerns. So looked, and I did too. The thing is with your chronic Lyme, fatigue is not new to you.
Exactly.
Like,
and that's something that we discussed too, right? It's like, and that's something that, and I think I've noticed a lot of people here have been following my journey that have come in. So I'll speak about this for a little bit, but like, I've never known a life without being chronically fatigued. And so for you guys, like, that immediately sparks like, okay, like sleep disordered breathing type stuff, right? But then I think about how far I've come in the last year, and like, I'm for the first time in my life going to sleep without melatonin. And like, I sleep through the night probably 80% of the time. So it's like, I feel like I'm doing better. And so it's one of those things where I'm like, I definitely want to look into it and rule it out, kind of like you talked about. But I'm also like, wow, like, we've made so much progress, but also it'd be great if we could make 100% progress, right?
Totally. Yeah. And when you sleep, that deep restorative reparative sleep, your body uses that time to clean the crap out of yourself. Okay? So that's really important. But when I went back and read your report, and my wording, if you don't mind, that I read.
Oh yeah, no.
Okay. So my report, or my wording out of your report, says, for your sleep concerns, that you have sleep quality or sleep disordered breathing concerns, that I recommend you be evaluated by a sleep physician to rule out any sleep disorders if the client does not see some improvement following the release and therapy. And then I went on to say that you have chronic Lyme disease, so it's difficult to see it might be difficult to see improvement, but you are very motivated to find out. So the reason I look at it like that, you guys, and for you, Paula, just, you know, just for your heart, so you know, like, okay, I don't have to jump on this immediately. We as practitioners, our job is to pass the buck. I never want to be negligent on causing somebody, you know, progression of disease or something. And sleep apnea is the most expensive chronic degenerative disease there is. So I always tell my clients, I'm just looking to pass the buck. But I also am a firm believer in medicine other than Western medicine. And I don't, that's why we're here. But that's why I don't jump out of the frying pan into the fire. So a lot of therapists will say, immediately, you have to have a sleep study, you have to do this, you have to do this. Well, and a lot of my followers here know that I used to go donate plasma twice a week, and I read research while I did that. That was my bribe to get all that research reading time. And so years ago, I read a research article that said that they found myofunctional therapy effective with mild to moderate sleep apnea after a period of 3 months, 30 minutes a day. So I said, doesn't it make sense that if I don't have somebody who's like just has all of these symptoms, all the things, doesn't it make sense that we don't, you know,
don't jump ahead?
The symptoms with a tongue tie are sometimes this similar and mimic sleep apnea. So when I look at the information, it's like, it makes sense. I don't think many people are blindsided by sleep apnea, okay? I know my daughter who has mild, and she only has mild on her back. So as soon as she rolls over, they average it out. So I know what she goes through at night. So I don't think that a lot of people are just like, shucky darn, I have severe apnea, right? I think those people, I'm telling you, those people have their head in the sand.
Oh yeah, I've met a few.
And so
he stops breathing.
Yeah, I gasp at night, and I have nightmares at night, and I have nightmares that I'm, you know, can't breathe, and so I think that's a big thing. Those cases, absolutely, I won't even start with them until they have that done. But in the case like you, when I said, okay, she's got concerns, I identified it. It's in your report. We talked about it. but it doesn't make sense. Like if the research says, hey, myofunctional therapy is effective with mild to moderate sleep apnea after a period of 3 months, I kind of like to get out there into that 3-month range.
Yeah.
You know,
Why
and
not?
I
One step
literally,
at a time, right? Like, let's see
yes,
what works and then let's move on. And I like that approach because, I mean, I've been thrown into the frying pan a million times in my life. And it's like, I'm tired of going down the rabbit holes. Like, let's just like one step at a time. And then, okay, do we need to move on to something else? Okay, great. Like, let's look there, right? But
yeah.
instead of being like, oh my God, there's so many things you need to deal with all at once, and then it just becomes really overwhelming, right?
And what do people do when they're overwhelmed? They
They
take
stop
the
all.
path of they take the path of least resistance, which is,
Exactly. Exactly. If you had told me that I had to get my tongue tie done, I'd have to go through X, Y, and Z hoops to even do it, I'd be like, well, I can't even do the tongue tie right now.
yeah. And that's great because we will talk about that is one of the questions a little bit later. So,
Perfect.
okay. So we talked about how it went. What did you notice during and after? I know last night we talked about the guitar strings.
Yes.
And you take it from here.
So I definitely didn't feel like the guitar strings, and we talked about it. I think there was probably two or three things at play. The first was I asked for laughing gas, which they don't usually do in releases, but I was like, I've had panic attacks on tables. I don't really want to do that here. So I was like heavily sedated. And then I was also very tense during the release. So I was kind of nervous and like holding really tight. So I think that could have probably prevented some of that. And then I also was thinking a lot about it, and I was like, I was bedbound for a year, right? So I was in bed like for a very long time with a lot of limited mobility. And so I think about it, I'm like, probably it's going to take a little bit more time for my house to settle, right? Like there's a lot happening here. And so I think we've really like opened the doors for my body to just kind of let go. And I have noticed like I have more mobility than I did. It's not like, wow, 100% like all is healed, but I have so much more mobility than I did before, which is great, right? It's a starting point.
It is. You're right. And I know that you were kind of feeling like, oh, what the hell did I do wrong? And that's not
Yeah.
it at all. And that's the biggest thing. Most people have that feeling.
Yeah.
That's the drug everybody's after. But that doesn't mean because you were so tense. Here's the thing. I can't wait to reach out to you tomorrow and find out how sore you are everywhere. Because I imagine that you're going to just be like,
Really?
oh my goodness. So pay attention.
Wait, should I be sore or not sore?
I think you're going to be sore,
Okay.
like because you were just tense everywhere.
Yeah.
And I think that your neck, I think
Yeah.
I think you are going to feel like you got ran over by a Mack truck.
Can't wait. This is so
I can't
exciting.
And
I
that's,
tell everyone no pain, no gains.
yeah, I think that you're going to notice some things tomorrow. I'll be curious.
Okay.
Again, everybody's journey is different. And I always just ask, hey, what did you notice? Have you noticed anything like as far as being able to breathe, take a deep breath, shoulders back, anything
It is
there?
kind of easier now that you say this.
That's one of the other things. So
Yeah.
aside from that guitar string feeling, people are always like, I can breathe.
Yeah.
I can breathe.
And I feel like my nervous system's like calming down a little bit.
Yeah.
And I think that's like, it's going to take time, right? But I'm like, I feel like it feels easier.
Yeah. And I know this is a simplistic view of it but when I have dental work done, I feel for a couple days like, wow, and I am addressing.
Oh, did you see the comment?
Somebody says your traps are not held as tight.
I took a picture of myself earlier and I was like, am I crazy? I was like, I swear they're usually like, it looks like my traps come from here.
Nice. And
Thank you.
I wasn't even looking at that. Which again is a good point because we see all of you guys joining in here. Ask your questions. We said this last night and then we lost the video. Some people did email me questions and I'm going to answer them. But ask your questions here so that I can make sure that they get answered. Okay. So let's move on because it looks like we've got about 30 minutes left. I have to teach you your lesson. I've got these questions.
Perfect.
We're going to rock and roll. Wound management is the first thing I'm going to talk about. And this is going to kind of talk also about stitches or no stitches. So I'm going to just kind of complete those. So a lot of providers, most providers, I guess I shouldn't say most because I have no idea what percentage.
Yeah.
So you guys, also the other question is laser versus, scalpel or scissors. It is not the tool. It is the brains behind the tool. Okay. So that people are doing a different mixture.
Yeah.
So that's the down and dirty answer. It does not matter. It matters their expertise. Okay. Before we talk about wound management, stitches or no stitches, I have my preference of no stitches. It obviously makes my job easier.
Yeah.
But I'll be quite honest with you, Paula, and I don't know. I'm sure Dr. Bieneman doesn't have this conversation, because
Right.
it's been so long since he does stitches now. But I do know for a fact that back in the day, it was like, you know what? Nobody wants to follow directions. Nobody wants to get up around the clock and take care of their wound. And they don't want to put their big girl panties on and do it. So we're going to stitch it up.
That's actually, I asked him, I was like, why do you do stitches? And he was like, I found in adults, they don't do their stretches. And so he was like, I don't stitch babies, but I stitch adults because they don't do their stretches. And so this just makes it easier to heal that way.
They
right?
don't do their stretches and they want to come back and clog up my schedule and get another release that costs him time and bottom line and probably ticks him off. So God love him. Hey, I don't blame him, but it makes it better for some and not for others. So I will always tell my clients, if your doctor is going to give you an option and you want to be a big girl, no stitches. If you don't, or an adult, not, I see males and females. But if you're not going to, if you're going to bulk at getting up every 4 to 6 hours and doing this stuff around the clock, then get stitches.
Yeah.
So wound care, you watched that video. Do you feel pretty comfortable with that now? You've got stitches. You know that these exercises that I'm going to teach you, basically tonight, I'm teaching you. Okay, you're not going to 100% do them. A couple of them you might be able to do better. And then the others, you're going to, as those stitches start to come out, you're going to have more movement. So the biggest thing is, do you feel comfortable and understand that as those stitches start to come out, there's going to be a point where you've got wound or stitches, and I've prepared you for both. And that always freaks people out because they're kind of like got those heart palpitations because now you're telling me things might go like this gray area. Yeah. And I had somebody fly in, see Dr. B, we're doing therapy at the airport. She lifted her tongue and just pop, 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 pop. And I was like, I
got so nervous that I popped my stitches earlier. I was like, oh no.
Yeah. So I asked Dr. B and he said for every day that those stitches stay in there, that's better. One of my colleagues always uses the phrase, close the window. We want to close the windows or close the curtains, not the windows. Yeah. And so that's the biggest thing. So normally you have this big gaping wound. When it's stitched up, this is healing by secondary intention. This is healing by primary intention. So that's the difference. And so you're healing by primary intention. But if at any point those stitches start to pop out, you have to look at it and say, okay, should I just start teaching? Like, can I get a little Western? Is it going to be okay if I pop that other stitch out? Because start taking care of that wound. So that's
and breaking it open. And
and it sounds absolutely barbaric, but it has to be done. Okay.
I watched my sister do it to my nephew and I was like, oh my
God. I know. So reach out if you have questions, but I just want to make sure that you're comfortable with that.
Perfect.
Okay. So let's jump into your session number 3. So you had 2 before. This session is what I call post-procedure. It's only about healing, really, for the most part. So I'm going to jump into your notes here. And so a couple of these things, good thing, because we're, chatty. A couple of these exercises you've already worked on. Okay, and I'm having you work on them again. Why? Because your tongue can reach a little bit further. Yeah. So fast clicks and TikToks. You're gonna continue working on that. And I will send your email. I need to make a note so when we're done, I don't just forget, like I just saw her. Send instructions. Do you feel comfortable with fast clicks and TikToks?
Yeah. Yes. Do you want me to demonstrate or?
No, you do
Okay.
not have to.
Okay.
And that's the biggest thing with this session. I always tell my clients, you have to understand. You don't have to do, you have to understand.
Okay.
Because some people, like I told you last night, tears running down their face. And I'm like, you guys, I have a rule. Nobody cries alone in my presence. And if you don't want to see my mascara running, don't cry.
So can I ask a quick question?
Yeah.
So obviously there's like wound healing and all that. So like today, like, am I supposed to start fast clicks and TikToks today, or am I supposed to kind of wait a little bit and wait for the pain to subside and then start kind of like the normal myofunctional therapy versus just wound healing?
Great question. So I teach these to you, and I always tell my clients, for these first few days, you get a grab bag. You get to be in control. Do something all the time. You have your stitches, so there's a lot you can't do, but you can still move it, okay?
Okay.
You've already done board lift, so that helps you, it's like if you do 100 lunges and sit in the recliner, you're going to be a little bit sore.
So sorry if y'all can hear me clicking.
So functional, easy movements, but pick something to do all the time. I always tell my clients, that's why I feel like that's a big part of my success for my clients, or their success, is they do something all the time. Set a timer on your phone. Every 30 minutes, do something. Lift the tongue, board lift, move it around. Do one of the things I want you to do. But so, for example, fast clicks and TikToks, 2 minutes twice a day. You're not going to think about 2 minutes twice a day for a while. Okay.
Right.
And so by the time I see you next time, which will be about 2 to 3 weeks, you should be doing everything as prescribed. But for these few days, you kind of get to pick, but do something all the time. So you might have your timer go off on your phone, and you might do a couple clicks. You might do a lip trace. You might do a couple of these other ones. 2 of the new ones that I'm going to teach you tonight, you're not going to get real Western with until those stitches start to come out. And you're like, yes, let's get those out of there. But that's a great question. So it's the only time I don't boss you around in therapy, when I say, hey, here, you
whatever you want.
Whatever.
And then he also gave me stretches. So I'm assuming like follow what he said according to that timeline. And then in between that, kind of just keep moving my tongue and like messing with it kind of thing.
Yes. And so all providers are different. I always tell my clients, take what I'm teaching you or what I assign you and take their instructions, follow their instructions. Okay. Because never, if there's a problem and you have to go back to him and
don't be like, I didn't do anything.
Oh, Carmen told me not to do that one. Carmen told me that one was no. So I always say, so take what I teach, take what he tells you. And if it seems like they're similar, some doctors will tell you to do the forklift. Well, I'm going to teach you suction and hold open wide. Same concept. So if you get super Western, you're going to just piss that tissue off. It's going to be red and sore, and it's just angry. So you need to do the minimum to accomplish what we want to accomplish. Does that make sense?
Yes.
Okay. So fast clicks and TikToks. You have also done lip trace.
Yes.
Lip trace,
I might actually be able to reach.
Yes. So visualize that you've got all those Oreos in there and you're just reaching.
Okay.
Slow, controlled. And then when you find those spots that you don't love, give it a little windshield wiper and give it some extra. But you should be able to reach further, and that's why I teach it. Couple reasons why I bring old stuff forward is because you've got some muscle memory, so you're uncomfortable, and I don't want you to learn. So I'm 1, 2, 3, 4, 5, 6 things. I don't want you to have to learn all new stuff. I want your brain's going to be like, I've been doing this. I got it. And so, but also you've got more movement now. So we've been preparing that tissue. Now you can reach in there. So you've got a comparison, but also it's not so overwhelming. Does that make sense?
It does. Cause like when I was doing the lip trace before, I was like, I can't even get up there on the top. Like the bottom, I could get it all. But then I was like, she's totally going to make me do this again.
Yeah. And so just pay attention because I want it to be an oval. And so many of my clients make it a triangle. So geography, right? is geography shapes? Yeah, triangles.
Yeah.
So practice that.
That's fine.
No, you want
This is why we're in healing.
Oh my, right? Yeah, because math was I am not. Although I was an engineering student at first.
I was going to say, I was actually a finance major and was in finance up until I got sick. So.
Oh my gosh, yeah. So I've been through differential equations and all that. And all I can say about numbers is if they're imaginary.
Yeah, no.
Or if it's like, if I'm comparing apples and oranges, no. Okay, 2 new
Lots of geometry teachers here.
Oh my gosh. Oh, we love everybody.
Fine, it's fine.
Okay,
it's a long day.
So 3 new exercises. Tongue workout X and box. So this is going to be a molar scrub. Okay. So if you had chocolate stuck on the back of your molars, that's what we're going for. Okay. Scrub a dub dub, not a tap. Scrub, 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 scrub is an X. Then box is going to be top, top, bottom, bottom. So this is what I'm not going to touch my camera, you guys. So normally I can get in closer, but this is X.
Okay.
And then box. So X and box is 1.
Okay.
I assign this 30 times a day.
Ooh.
Can you do that right now? Maybe not. But if you can, start scrubbing your premolars.
Ow. Okay.
And just move it around.
Yeah. Okay.
Okay. Remember how much you liked me before today.
Yeah, not a lot.
Okay, next is tongue trace.
Okay.
Tongue trace is one that everybody loves after the fact, but obviously with stitches, you got to get to that point. So you're going to start with tongue on the spot. You're going to trace the palate towards the uvula for a count of 5 and forward. Okay.
Okay.
This is what it looks like when I do it.
Wild. I can do that now.
You can? Have you tried that?
I've definitely thrown my tongue back. Let's see.
Good job.
Thank you.
So everybody always reports that's like the itch they can't scratch. Like, oh.
Yeah, I can't get all the way back to the uvula, but I can get like pretty close, I would say. But the sideways tongue is a lot more painful. The front and back
everybody is different. So and don't avoid the ones that you hate. Okay. In fact, do them twice as much, basically. Okay. One last new one. Suction and hold open wide. So I just talked about that. So you've done suction and hold.
Yeah.
You've done tongue on spot open wide. Now we're going to just marry those.
Should I try it right now?
Sure.
Oh, that hurts. Okay.
And so you can't go back down just because the whole point is it's really a pull, break open. One. So that might be one that you're like, okay, I'm going to leave that for a hot minute.
A little bit, yeah.
Until the stitches are out. So that's the biggest thing for me, stitches and no stitches. I still teach the same. It's just like, okay.
There's more restriction with the stitches, right?
Yeah, absolutely. Okay, so fast clicks and TikToks, tongue workout X and box, tongue trace, suction and hold open wide. Again, that's 30 times a day. What that just means is just do it a lot. Okay,
so it's not like I need to hold it for a minute 30 times a day. It's just like suction and hold, put it down, suction and hold.
Yeah, it says count to 5.
Okay, perfect.
Count to 5.
And can I do them all at once, or do I need to break it up throughout the day?
You don't want to do them all at once to start with.
Great.
Spread them out because you're going to get overwhelmed. You're going to be uncomfortable, and then you're going to not want to do them. So I wouldn't. But as you start feeling better, you can do them. You can do real life, whatever works for you.
Perfect.
And then last, you're going to, so I said workout X and box, tongue trace, suction and hold open wide, lip trace, and one elastic hold for 45 minutes. Okay, so I'll send those. I'm not going to waste time messing with it now, but I'll send those when we're done. Okay, let's get your numbers. So when we started therapy,
Oh, yeah.
You felt like let me go back here and look. Oh, look, tongue was on the spot. Tongue was on the spot 0. Interestingly enough, you guys, so tongue was on the spot 0. Middle of the tongue was in contact with her roof of the mouth, 40%. So that tells you her tongue posture was.
Was that last time or the first time?
That was the first time.
Okay.
Then, look at you. So session number 1,
Well, I was like, I didn't even realize I told you it was on the middle because I don't really know that it was.
Yeah. And then, so session 2, tongue was on the spot 90%. So when we started therapy, you went from 0 to 90. What would you say you're at now since I saw you last time?
I feel like it's somewhere between 90 and 95, I would say. Like, I'm also one of those people that can never give myself 100%.
Yeah, no, I completely agree. So I'm gonna go with 90 because I always shoot low, and we'll just continue to monitor it. Nasal breathing, mouth closed was 95. That's probably about as good as you're gonna get. That's normal for you, right? Middle of the tongue was 60 last time. What do you think it is today?
I feel like it's more than that. I do catch myself if I'm like really resting. It's just tip of the tongue, and like you can see it, like my whole throat's like down here. Like I have a frog throat, and I'm like, no, pull it up. So I would say it's more than that. I would say maybe 75%.
Okay. We'll go with 70.
Yeah.
Remember, I always talk about here's where we are, here's where we're headed, or what I do.
Yeah.
My tongue goes to the spot and I just roll it up and by rolling it up, I roll it to the roof of the mouth. It's like I'm rolling the air out of a bread sack.
Yeah.
Okay.
Can I ask a question really quickly? Because I'm sure other people are probably curious too. So obviously we've been trying to get the middle of my tongue up. Now that I've released, is the ultimate goal to get the full tongue all the time?
Whole enchilada, tip to tail. You need to have lingual contact with the back of the tongue and the soft palate. So the whole enchilada. So most people start here. Some people start here. Then we bring the middle of the tongue up, and the back of the tongue is eventually going to follow. So that's why I talk about we're doing this.
Yeah.
Because that's natural for my tongue. My tongue 100% just lives up there.
Just does it.
It's not suctioned.
Yeah.
A lot of people suction their tongue in the roof of the mouth. I think that makes it easier, and therefore I think that's cheating. But mine just rests. That's just, it just rests. So.
Yeah. It's so funny. I'll tell people like, you're supposed to have your whole tongue up, and they go, that's impossible. I choke. And I go, you really wouldn't. You're supposed to, but you think that because you can't.
Yeah. See, I mean, that's the thing is people don't know.
They don't know. No, you're born tied. How would you know?
I always am the one who points out the things that are broken, know, because people just don't know. So, okay. So we're cruising through. I probably am not going to get all these questions answered, but I'm going to do my best. The thing is, you guys, what's next for Paula is she's going to heal for 2 to 3 weeks. Watch for an announcement because there's a lot of you guys here who are fascinated. You're invested in either me or her. We're going to do that next therapy session or that next chat on her Instagram. So I'll make sure that you guys all know that. So we'll be seeing how she has healed in the next few weeks. So we haven't picked a date for that yet. And remember, we'll go back through and answer questions. A couple of these questions that I have from last night that I have been emailed. I'm going to do what I can here in the next couple minutes and answer some of those. And then I'll have to just do some more stories and stuff.
And we might be able to run over because we started late, right? Or does it block you on the hour?
Oh, that's right. I don't know. So we'll see.
We'll find out.
Will they just disconnect us like...
Oh yeah, and then you lose the video, but you're recording, so.
But I'm recording, so. Okay, so we won't get so worried about it. I'm terrible because when I do a Zoom call sometimes with clients and I'm like, I hate not being able to say goodbye. That's my biggest thing. Is I hate just being like, click. Okay, So first, do I need to do expansion before starting my own having a release? This is going to be individual. Paula and I had this conversation. I have this conversation with every client. There's a difference between the ideal world and the real world. My tongue is bigger than my arch. It fits beautifully, okay? You couldn't ask for it to be better. Lots of my clients are that way. Some people come to me and they just want to release. They don't have any interest in expansion. If somebody has airway concerns, they have airway crisis. I don't know about you guys, but I would much rather have airway ortho correction than to use a CPAP, which is the gold standard of care for sleep apnea. Compliance is under 40%. So it just really, it just depends. So I don't have an all-encompassing answer. The best thing to do is start with an exam, and we'll talk about that here in a minute. How do I find a provider? I help coach you. I help you in that process. Like Paula and I work together to find somebody. The biggest thing is you got to find the right person. So when I do an exam, I might already have somebody in that area. Like anybody in Montana goes to one person. Anybody in Washington goes to one person. Kentucky, Texas, Colorado, it just varies. And so I help with that. I also have some fantastic blogs, which leads me to, there's a lot of resources on my website, you guys. Tons. I spend hundreds and hundreds and hundreds of hours every year educating, speaking, lectures, webinars, that kind of stuff. So if you can't find it, email me and I will share it, but you can go to my website. There's tons of
That actually brings up a really great point in how I knew I wanted to work with you. I went deep on your website, knew you knew your stuff, and then I found a talk that you did. It was like an hour long, like how to figure out if you have a tongue tie. And I watched that and I was like, this is it. I'm working with her and I already know like there's a 98% chance that she's going to say I have a tongue tie. So for those of you who are interested, go find that video.
Yeah, it was a lecture that I did. And I believe that was a lecture where I was teaching dental hygiene. I was teaching. It was a teaching lecture. So because I teach myofunctional therapy, and I also lecture at hygiene schools to graduating hygiene seniors. So that's probably what that was. But that's the reason I say I have the best clients on earth, because by the time you get to me, you know you want to work with me. I don't care about what else is going on out there. I don't care about anybody else. It's a good match here because you've already done your homework and you know that you feel like we're a match. So that's awesome. Thank you for that.
You're welcome.
Is YouTube therapy effective? Not no, but hell no. And here's why. You, if you want to buy if you want to just have the ingredients for a recipe, but not the directions, to my knowledge, there is not a complete framework on YouTube. I call it piecemeal therapy. I only work with people who want to go from A to Z. So if you want piecemeal, you'll find piecemeal out there, but you're not going to find what you do here and then here and then here and then here. Most people who want wellness, they want to seek out an authority and an expert on the field. And the same, any sort of wellness. I mean, my cancer, well, I didn't get on Google and try and figure out, I just went to the best person for melanoma.
Right.
And probably, Paula, with your health journey, the same thing. So I get that a lot. There's free stuff on the internet. Why do I need to pay for your therapy? Not my person, number one. But number two, you're not going to find the complete recipe out there. Make sense?
Yes.
Okay, I'm trying to answer these questions as quick as I can. I have terrible migraines. Will this help? I'm always careful with clients who come to me for one thing. Because again, going back to that magic unicorn horn, poking you in the butt while you sit in a pot of gold. No. I work on tongue posture, mouth posture, nasal breathing, swallow, correct, and normalize. I'm a migraine sufferer. My migraines come from structural misalignment. So if that's what causes your migraines, you're probably going to have some success. If you have migraines from hormones or perfumes or somebody's nasty dinner, smells, that kind of stuff, probably not. So I'm very careful. I never want people to just come to me, and I generally won't work with people who are focused on one thing because they've got this vision going on. Like they're not looking at the big picture. tunnel vision. They just, I understand they're desperate because trust me, when I have migraines, I want anything to solve them. But it's hard to say. Now, if it's a tension headache, that's different, but we're talking about migraines.
Yeah.
So we just see. Generally, when people come to me for migraines, they learn about all their other impairments, and then they're like, oh, okay, I need to fix that too.
Yeah.
So that's kind of how that comes up. I feel like I'm okay. Can you just help me with swallowing? No. The reason being, Paula, you laugh like, you probably know this answer, piecemeal therapy. I only work with clients who want to fix from here to here. Anybody who has a tongue tied, Paula, you've said it, you don't swallow right. I tell everybody, I would bet the farm. I've
don't
not
swallow, you don't breathe.
Nope. And so I will not only help you with swallowing, because all of these muscles, you guys have to work independently before you can ask them to dance together. Yeah. I want no part of you wasting your money and having crappy results. So unfortunately, that's how it is. But no, I'm not going to just help you with swallowing, because we have to build the foundation. We don't build a house on quicksand, and I won't allow that for my clients. Last, oh my gosh, I'm down to the last. And I'm going to do this quick. Because I want to answer the question, but I feel like it's a shameless plug. A lot of you guys reached out to me for one of two reasons. You are a myofunctional therapist and you don't have this kind of success or excitement with clients, and you're really nervous. And some of you just want to do this because you want to help. And so I want to talk about that, because I did get a lot of emails like that. Myofunctional therapy is for dentists, dental hygienists, speech therapists, okay? It's in their scope of practice. There are some other random allied health fields. Obviously, a doctor could do it. I've yet to meet one that's doing it. Not saying they're not out there. Occupational therapists, some physical therapists are doing not necessarily what I do, but some part of it. And so I definitely don't teach them, okay? But I teach speech therapists, I teach dentists, I teach dental hygienists. You have to obviously have that background. You have to have a license. You need a course that works for you. So you have to figure out what is going to work for you. There's a lot of options out there. I have the Myofunctional Therapy Training Academy. And also I have a program that closes the end of the month called Ditch Hygiene Academy. Not only for hygienists, but it is only offered in the summertime. So that's really all I want to say. If this is something you're interested in, let's talk about it aside from this, because this is about Paula. But I wanted to answer that question and make sure that we touched on that. So I do teach it. I have a course open now. I have a course open all year long. And of course, I have to say, and you are a very good teacher. Yay! That was timely. Okay, so last, Paula, closing thoughts.
Oh gosh, I don't know. I guess I'm sure I wonder this, and I'm sure other people wonder this. Like, okay, we've released, and now obviously we're gonna do, like, what are the next steps? Like, how do you kind of like build that foundation and keep going in terms of like what you target next? Then like we keep growing. I'm curious myself, and I'm sure other people are probably curious as well.
Absolutely. So now we start the rehab process. So now you've got that movement. You've been working on strength coordination. I always say we work on strength, coordination, and new neuromuscular connections. Okay. So there's going to be plenty of things where you're like, yeah, Carmen, I'm not an idiot. I understand it. My brain gets it. My tongue is acting like a 2-year-old. So there's that. But they're building blocks. Swallowing takes me 6 sessions.
Wow.
To teach. So those are all pieces of the puzzle. The rest of the time, we're working on strength, coordination, so all of those pieces. But we just continue building. You're going to be with me for the total of 12 sessions. So in that time, I teach you all the stuff. And then when we're done together, are you done?
Never.
No.
What's the one thing I've learned? You're always healing. It never ends.
Yeah, absolutely.
It's a journey, not a destination.
Yeah. And it took me 1.5 years to correct my swallow. So that habituation and retention, it takes some time. Yeah. But that's what happens next. And that's good, because once you heal, then it's just that rehab. You got to learn to do things. You got to learn to do things. Some things are going to be easy. Some things are going to be harder.
Yeah.
Okay, so remember, you guys, we're going to be doing another live here after Paula heals for a little while and just has a moment. Where can they find you in the meantime to follow you and make sure they check out your Instagram information? Don't do it when you don't have time. I'm telling you.
You might go down a few rabbit holes.
Right.
So my Instagram is just at Paula Marie Salas, and then I've made it really easy. My website is also at Paula Marie Salas, and I do, for those of you who aren't familiar, right now I'm working on like emotional energy type healing, and then I'm also planning to open a physical healing practice and helping people overcome chronic illness as well. So stay tuned for that. Should be launched in the next few months. So yeah,
nice. Maybe I can have you back and we can do something totally not.
Oh, I would love to.
Something totally not about tongues. Last, if anybody wants to or feels like they need to schedule a free assessment with me, you can find that here in the link. But most of you are probably ready to jump right into your comprehensive exam since Paula has a discount going on. There you are.
Oh, we're here. I thought we lost it. I was like, oh
No.
no.
My dog takes pills, and it's now time for those. Discount code, Paula99.
Yes.
When you schedule that on my website, it gives you an exam for $99 instead of $175. Yeah, 99 instead of 175.
Perfect. And I'll put that on my stories too, just so everyone remembers.
Perfect, because I felt bad that wasn't out there last night.
Yeah.
Afterwards. So again, thank you guys for commenting, for coming, for being invested in this journey. Whether you're here as a myofunctional therapist who's trying to figure out your place in the field, or to develop your level of confidence, I'm glad that I can help mentor you in that way. For those of you who have tongue-tied questions, breathing, tongue posture, all of that stuff, that's all my jam. I think you can find me by using the link in the profile. I'm losing my words. Thank you, Miss Paula. I will be checking in on you tomorrow to see how you're feeling.
Good.
Rest heavy tonight. I bet you sleep like.
Oh my gosh, I'm so excited to sleep.
I know, I bet, because you just had that overload. Thank you for doing this, and I will be in touch for you with you tomorrow. And with any luck, when I hang up here, it's
gonna save. Everyone, say a quick prayer. This is gonna save.
All right. Thanks everybody for being here. Paula, you're wonderful.
Bye.
All right. Bye-bye.